Another issue that I see confused in the trauma bay at our institution is using a pelvic binder and how that relates to the ABC. So my question is, do you need an x-ray of the pelvis, or can you put a pelvic binder on based upon physical exam?
I think that the answer to that question is based a lot on the patient in front of you. There are times where it's pretty obvious a patient on clinical exam and palpation has a pelvic fracture. I don't know about how things are, where you are right now, but in Detroit, if everybody's BMI is 45, it makes that physical exam harder to decide. So I think it can be very difficult in a large individual to really get what you feel is a definitive physical exam. And you have a pretty unstable pelvis that is, cushioned by a lot of soft tissue that is pretty hard to diagnose that way. So I think it's always in your mind of, a place of possible blood loss when you're playing the game, sort of blood, where's the blood? Why is the patient hypotensive? The pelvis is certainly in that area, and I wouldn't wait to put a pelvic binder on if the patient had the physical exam. I just find it sometimes, hard to know by physical exam where that is, and a pelvic x-ray can be obtained pretty quickly. You're also in the scenario that you're looking for, deformities of long bone fractures. Hopefully by that time you've also at least got an idea there's breast sounds on both sides of the chest, so you know that the chest isn't filled. The abdomen is a little bit more problematic when you're trying to decide where the blood is. You get the fast exam out, but that comes a little bit later. But I think you can do it on a physical exam sometimes, but unfortunately, and I think as the national BMI rises, I think that physical exam's hard, frankly, in a true clinical scenario.